and I have a bachelor's of science degree in radiation therapy technology. Well, I started my career as a radiation therapist. I currently work at Penn State Health, St. Joseph. I'm the Breast Care Patient Navigator, and I've been there for 12 years now. When I was getting ready to go to college, my uncle was diagnosed with lung cancer. He was really the first person I knew that had cancer, and his battle, though, was not successful. He tried so hard. He even went to Mexico. He passed away right before I graduated high school, and I thought I'd really like to go into a medical field. But I really loved physics. Radiation therapy technology is very heavy in physics. And so I settled on that, and really it's been my passion ever since. As a patient navigator, I have to break down whatever barrier there is to prevent a patient from getting the proper care. The proper transportation is a huge issue for many people, and financial. People may have health insurance, let's say through Medicaid, but it doesn't help pay all the other bills. I just tell everybody I'm their go-to girl. Whatever they need, come to me first. If I can't figure it out, I'll get help. A couple of years ago, I had a patient who was homeless. I had never really had a homeless breast cancer. She and her two children were living in the band shell, and she was only in her 40s. Her cancer had spread to her spine. She had to have neurosurgery. It was bad. So for the first time, I had to help a homeless person find shelter and food and finances, insurance. It was a very eye-opening event. Through working with her and the volunteer work that I do for a breast cancer organization, we're really able to help her get settled, get the treatment that she needs. And now, though things aren't perfect, she has a roof, she has food, she's doing better with her cancer. Her children were able to stay with her. It really was kind of a defining role for me to be able to help somebody that truly was down and out. I don't just work with breast cancer patients. I volunteer for an organization called Breast Cancer Support Services. They support any man, woman, and family that's dealing with breast cancer. I was their president for 6 years of the organization. Now I'm on the board of directors. That too is very, very full work because all their services are free to breast cancer survivors. That is very meaningful for me.
Bless you.
My sister-in-law, Bonnie Loy, Lee's sister, became involved in Wreaths Across America. She worked for the VA, and Bonnie came to our beautification committee and said, "Did you know we have almost 1,200 veterans in the little cemetery in Ebenezer, the Greenwood Cemetery right on 72. We all said, "Really? We even have a grave from the Revolutionary War." We decided that with Bonnie's lead, that we would try and gather up wreaths to cover all of the graves at our little local cemetery. Since then, I've become secretary and been all involved, but myself, Gwen Yorty is our president. We have a whole team of people, and we have had different projects through the years. We've also had a couple Eagle Scouts build us 2 pantries. They are widely used. We just got a compliment from a woman who wrote us who said, "I don't drive and I love to because she can't get to the library." She was very thankful that we had some really good books. It has a couple benches. We have bricks that we sold to help fund it.